This video covers patient management workflow in Nikshay. Patient management begins with identification and screening a person who has symptoms, then comes diagnosis, then providing all the care continuum for TB treatment till an outcome is attained. After treatment, the patient is followed up for 2 years. Let's understand the workflow of patient management. When a person visits a doctor with symptoms of TB, the doctor, peripheral health institution or an appropriate user enrolls him as a presumptive case in Nikshay using the new enrollment module. Enrollment can also be done by a user after a case is diagnosed with TB. The person is sent for diagnosis at a laboratory or an X-ray clinic or for other appropriate investigations. Diagnosis details can be entered by the diagnosing facility. If the case is diagnosed with TB, then treatment of TB is initiated. The user, which is usually a PHI, then enters treatment details and all other public health actions related to TB treatment. This includes providing him or her with a prescription of TB drugs, examining him or her for comorbidities, screening his or her contact persons, assigning a health facility and staff from where or whom he or she would be accessing treatment, and whether he or she would like to receive notifications or calls regarding his or her treatment. Enrollment, entering test details and treatment initiation is a one-time process to be done by a user. The next step is adherence monitoring, which is a continuous process undertaken by treatment supporter or staff. Follow-up tests are done for a TB patient at appropriate intervals, hence, this is entered in Nikshay multiple times. Once the treatment is over and an outcome is available, the case is closed in Nikshay by the user. Let us now understand auto-calculation of patient status during patient life cycle. Once a new enrollment is done, a patient is assigned a presumptive open status in the Nikshay system. If the result of patient's test is negative, his or her status will show TB not diagnosed. If the patient's diagnostic test is positive, his or her status changes to diagnosed but pending treatment notified. When the patient is put on treatment, then his status changes to on treatment notified. Here, you need to know that for private patients, user can directly start treatment without adding tests. After an outcome has been assigned to a patient, that is, the case is closed in Nikshay, the patient's status changes to outcome assigned. This completes patient management workflow in Nikshay.